Greetings, greetings, greetings. My name is Christopher Fleming, and this is a net analytical study on the lifestyle factors and heart attack severity in Nigeria. As an introduction, heart disease still remains as a significant health issue globally. Lifestyle choices such as smoking, BMI, body mass index, and cholesterol impact heart attack severity. And this study analyzes the Nigerian heart attack data to assess these factors. So the methods that we use is that we sourced a data set from Kaggle that had nearly 900,000 entries. And the key variables were age, BMI, gender, smoking, and cholesterol levels. And we performed a scenario analysis to was performed to examine the health impacts. Smoking and heart attack severity. Smoking is widely recognized as a key factor for heart attack. Our data confirms this. And smokers have a slightly lower survival rate than non smokers. And even small differences of survival rates can have a significant public health implications. Here's a side by side of the non smoker versus smoker survival rate. And this is what was the most interesting to me here. Some key insights from this is that the youth experience more severe heart attacks than adults, especially smokers. Youth females have a slightly higher survival rate than youth males. Possibly that could be due to lower smoking rates. And non smokers in all of the age groups show better survival rates, reinforcing the dangers of smoking. Smoking significantly increases the likelihood of severe heart attacks, especially in the youth. And youth non-smokers had a better survival rate than youth smokers, 50.4% versus 49.9%. Adult smokers often experience milder heart attacks, but their survival rate remains low, around 49%. This insight was enforced or supported by um, Ade, Adelowe, who found that 20% of Nigerian youth smoke compared to fewer adults, which explains the severity of youth heart attacks. Okafor also noted that women tend to survive heart attacks at slightly higher rates, aligning with the data sets that we found here. Exercise and cholesterol levels. Exercise and cholesterol levels are important factors in heart health. The data shows that patients who exercise regularly and maintain healthy cholesterol levels experience less severe heart attacks and have better survival outcomes. BMI and heart attack mortality. Body mass index or BMI is another important factor in heart attack severity. The data reveals that individuals with a BMI over 30 tend to experience more severe heart attacks than those with a lower BMI. This emphasizes the importance of maintaining a healthy weight. So, the key findings from this study, we can conclude that smoking and obesity increases heart attack severity, while exercise and controlled cholesterol levels will improve survival rates. Public health measures should focus on education and the prevention strategies to help reduce these risks. And we have a few recommendations of ways to do that. One, by strengthening public awareness and educational programs. Many Nigerians are lacking the awareness of the heart disease risk factors, and these national campaigns should include educate people on the dangers of smoking, unhealthy diets, and high blood pressure. heart attack warning signs that was provided by the World Health Organization. And for an example, have a national TV and radio campaign explaining how reducing salt intake and exercise can reduce heart risk. Others, such as tobacco control and cessation programs, perhaps maybe a higher tax on cigarettes to discourage smoking, or banning tobacco advertising and sponsorships, as was recommended by the Nigerian Tobacco Control Alliance in 2023, and providing free or subsidized smoking cessation programs. An example of this was in Rwanda. They did a smoking ban and it reduced tobacco use by 25%. And this is according to the Global Tobacco Report of 2022. Further, we could improve access to affordable health care and heart screenings, expand free or low cost blood pressure and cholesterol screenings, equip more hospitals with cardiac units and trained specialists, and make heart medications more affordable, such as the World Health Organization's Heart Initiative, which has helped African nations like Ghana expand cardiovascular care. Nigeria could adopt a similar model, encouraging healthier diets and reducing salt intake. Promote heart healthy diets through with more fruits, vegetables, and whole grains. Introduce food labeling laws to inform consumers about salt and fat content, and regulate fast food industries to reduce unhealthy ingredients. An example of this was South Africa's salt reduction law, which reduced salt intake by 30%, lowering heart disease cases. That was provided by the UNDP in 2022. Others would be promoting regular exercise and physical activity. Sedentary lifestyles contribute to obesity and heart disease. So Nigerians could develop more public parks and fitness centers, encourage walking and cycling through better urban planning, and encourage physical activity into school and workplace routines. An example of this happened to be in Kenya with their community fitness programs, led to it led to higher exercise participation, reducing the heart disease risk. And that was according to Africa Health Research in 2023. Controlling hypertension and diabetes. High blood pressure, hypertension, and diabetes are major contributors to heart attacks. So, Nigeria could increase nationwide blood pressure screening programs, subsidize medication for hypertension and diabetes, and train healthcare workers to better manage these conditions. Examples of this was in Uganda, who had community health worker programs which increased hypertension control by 40%, according to the Lancet Global Health in 2022. Reducing stress and improving mental care. Chronic stress increases heart risk, so Nigeria could encourage workplace wellness programs, expand access to mental health services for anxiety and stress management, and promote traditional stress relief methods such as meditation and social support. An example of this would be a Nigerian study found that high stress levels among urban workers. Workplace wellness initiatives could reduce those cardiovascular risks. And this was in the Nigerian Journal of Cardiology back in 2023. And finally, strengthening emergency heart attack response. Delays in medical response worsen the heart attack survival rates. So Nigeria could improve ambulance services and emergency medical training, educate the public on CPR and first aid for heart attacks, ensure hospitals are equipped with defibrillators and proper cardiac care. For an example, Ethiopia improved emergency heart care by training community responders and reducing heart attack deaths by 20%. And this was in 2022. See, this one right here has a pull on my heart in particular because this can also be a opportunity for Nigeria's public libraries and different library systems. Because here, just for an example, in South Carolina, I manage a branch in Richland, Richland Library System. We are equipped with Narcan to help with the ongoing drug addiction, fentanyl crisis, and things like that. And we have been trained on how to administer these, the medicine needed to help if we came across these overdoses. We're also equipped with defibrillators. We're also equipped with CPR training and the like. So this could be an additional recommendation could be Nigeria to invest more into their public library system and develop that library system as not only as a place for information about the risk involved with cardiac arrest and maintaining a healthy lifestyle and things like that, but it also can be a hub of community engagement and community action where if there's still instances where transportation might be an issue to get to some of these hospitals, public libraries can be a place that you know uh, other trained hands can be, where one might be able to find defibrillators and the like to be able to help combat this ongoing issue within Nigeria. So, um, to reduce heart attacks in Nigeria, which is going to include stronger tobacco laws, better healthcare access, improved diets, and improved awareness. By implementing these strategies, Nigeria can significantly lower heart disease cases and improve public health. These are my references for some of the examples that have happened across Africa so far. And I thank you all for your time and your attention. Again, my name is Christopher Fleming, and this is my analysis of the heart attack rates within Nigeria and my recommendations to help curb this ongoing problem. Thank you so much for your time and attention.